and cry of COVID 2019. There is great pressure on physicians to come out with a clear-cut answer for the disease, treatment and diagnosis. But good sciences, however, takes time to come out with a definite answer for treatment, diagnosis and disease activities. I, Dr. Somnath, Chief of Tricolour Hospital, Hyderabad, will share certain facts that is important for the general public. Now, question is, what is Corona? Corona is a virus disease. It is caused by SARS-CoV-2, systemic respiratory syndrome, coronavirus 2. Now, second question is it same as flu? No. It is much lethal than flu virus. Now, what are the commonest symptoms? Commonest symptom of coronavirus is fever. Although patient complain with the fever, cough, body aches and breathing difficulty. Now, how will you diagnose the coronavirus? First, we have to see the symptoms of fever, body aches, cough and breathing difficulty. Any one of these present in this pandemic, you need to go for the test. That is, there are two types of tests commonly available and government is insisting on that. That is RT-PCR test and coronavirus antibody test. RT-PCR test is a type of test that is done with a nasal swab or throat swab. It is almost 70% positive in the first week of the infection. Antibody test becomes positive 70% after first week. That is IgM antibody, coronavirus IgM antibody. Now, when there will be the positive first case, it will be positive first case. Usually it happens after first week. Can COVID-19 be transmitted by asymptomatic people? Yes, it can be transmitted by asymptomatic people, but their probability of transmission is very less in terms of public health terms, like if people are telling hot spot and red zone. Asymptomatic transmission is very less in compared to symptomatic transmission. How likely is someone to contract COVID-19 after having contact with the coronavirus patient? No. Roughly it is less than 1 to 5% transmission is possible with the coronavirus symptomatic patient in general. But in closed household contacts, it is around 10 to 15% that coronavirus people can infect to other people as per the latest CDC guidelines. Now, the third question is, how long an infection will be there once a person is got infected? Usually, in less severe cases, once symptom goes off, like patient becomes afebrile, no fever, no cough, no body ache, it will be for 2 to 3 days. But in severe cases, it can continue for many weeks. Now, as per the latest data, worldwide there is a infection of more than 2 million people and death is 123,000. You people are hearing and reading what is the epidemic and what is the pandemic. Endemic is the Greek word, it means the place. Epidemic means any new disease that is coming on that particular place, particular area. It is not spreading far and beyond. Pandemic means when it affects or infects a wider geographical area like state, country, continent and all over the world. Because this coronavirus is affecting most part of the world, it is called pandemic. Now, what is outbreak? Any new things coming in a particular area, that is called outbreak. Now, what is index case? It is very important. You people might be reading in the newspaper. What is index case? Index case is the first case detected in that particular area, is called index case. From that index case, other people gets infection. Now, what is epicenter of the disease? Like in earthquake, you find out epicenter is Delhi or epicenter is northeast. Like this, in epicenter where it has originated, as per the data, in a place in China called Wuhan, considered to be the epicenter for this coronavirus outbreaks. Now there are now what are the things that people these days, there is a dearth of masks and sanitizers. People are very much worried. They are not getting masks or getting at the higher prices. Nothing to worry. There are two types of masks, N95 mask and surgical mask. You can get surgical mask easily and at the less price. Surgical mask is good enough for the common public. N95 mask. N95 mask is useful and it must be used by the healthcare workers who work in the hospital, work in the clinic, or there are a high probability of chances of coming in contact with the coronavirus infected patients. Now, what is N95 mask? It is simple coding system. N means non-void. Non-oil means if there is no particulate matter based on oil-based particulate matter, you can use it N95. 95 means it can protect or it can filter out the particle sizes above 0.3 microns. That is N95. There are N99 masks are also there, but N95 is good enough for the healthcare workers. Now there are certain myths that you must understand. Alcohol consumption can reduce coronavirus? No, in fact, it may harm you by affecting your immunity. Garlic and ginger will protect you against the virus infection? No. It will increase your immunity, show that you will be better placed among other people. Another myth, I have no risk of corona infection from a healthy person. Any healthy person may be an asymptomatic carrier of the coronavirus. That's why social distancing is must. COVID-19 is an airborne infection? No. It is droplet infection. It can spread through fomites also. Another myth is homeopathy, Chinese, Unani has the cure. There is clear cut no. Hand sanitizer is as effective as hand washing? No. Appropriate steps of hand washing are important. In this hand washing, you must understand soap. 20 seconds rinsing with the soap will destroy the virus because it is the RNA virus. The soap destroy their fat layer and it gets destroyed. Another common myth is that food items we like vegetables we buy from the market that will infect. There is very low chances of transmission from the vegetables and other things. However, to be on the safer side, before using the vegetables, fruits, you must wash it properly and wash your hands properly. Another myth is that non-veg can infect coronavirus. It is clear cut no. Another myth is there, coronavirus won't survive in Indian summer. It is purely false rumor. No data available in this. Novel coronavirus gets killed at temperature above 560 degrees Celsius. Coronavirus with hot weather have reported cases in many parts of the world. Now, what are the prevention you need to take? Very simple. A, B, C, D. Very simple it is that A, B, C, D. Now start from D. Do not go out. C. Clean your hand. B. Beware of fake news, whether it is WhatsApp or Facebook. A. Avoid contacts. Next video will come with the coronavirus with lifestyle disease like diabetes, blood pressure and heart problem. Thank you. Thank you very much.